Joining me today from New York, Mary Holland. She's the president of Children Defense. You are most welcome on the Capital Show. I'm so glad to have you.
Delighted to be here.
My first question is about what inspired you to transit from academia and law into vaccine policy advocacy and health freedom activism. What was the reason and the motive?
Well, I did teach at Columbia and NYU law schools for almost 20 years. But while I was teaching, I was researching and writing about and testifying in state legislatures about vaccine law and policy. I have a young adult son who was severely injured by his childhood vaccines, in particular the measles, mumps, rubella shot. When I realized that it was a very strange world, that no one would acknowledge that that might be the cause, and then there was no remedy, and there was no one to go to, and there was no information about how to overcome vaccine injury, I thought, oh my goodness, this is this morass. This is this really incredible wilderness, and I'm going to use my resources to try to study this. So then as I said, I taught for about 20 years at both Columbia and NYU. And in 2019, I had written a book about the Gardasil vaccine, the human papillomavirus vaccine. It's called the HPV vaccine, Seeking Justice for a Generation Betrayed. Yeah. And basically, the university, NYU, made it very clear to me, we don't want you to write anything like this again. We don't want you to do research. We just want you to teach and shut up. Yeah. And at that point, I thought, this is not a place for me to stay.
Yeah, that was during COVID or before COVID or after COVID?
Oh, this way predates COVID. What happened during COVID, Maria, was that the whole population was told to take a vaccine. Before COVID, it was really only children and college students to some extent, up to age 22. And then they really couldn't touch the adult market, except for healthcare workers, sometimes like kindergarten teachers. But basically, they didn't have access to the whole population. In COVID, the objective was to get literally every person on the planet to take these experimental messenger RNA shots. So people became much more aware of this problem of lack of information and an intervention that actually could cause severe injury or death.
All right. I want to know the most important cases or campaigns that CHD has led under, especially this after COVID. What was the most important campaign that you led?
Well, we have many important campaigns, Maria, but post-COVID, we are still, we've fought very, very hard that people who exercise their religious freedom and said, no, it violates my religion to take a COVID shot. We're still representing those people. We're representing many workers, especially New York City workers, whose religious exemptions were rejected. We fought very hard throughout the last 5 years to ensure that no children in public schools were coerced to take COVID shots. We also recently won a partial victory that Health and Human Services and the Centers for Disease Control withdrew their universal recommendation that all infants and children 6 months and up get COVID shots. Now that recommendation is between a physician or a healthcare practitioner and the family. It's not a universal recommendation, although it's still there. We have been involved in campaigns to end censorship. Maria, since even before COVID, we have been censored by Facebook, by TikTok, by YouTube, by Google, because what we purvey was considered misinformation. That's not true. What we were purveying was truthful information, and the government, in large part, was purveying misinformation. But so we've been fighting censorship, and we fight all medical mandates. We believe that all medical interventions must be voluntary and that people must have the right to choose what medical interventions they want.
What is the legal landscape? Can we consider that the U.S. legal system protects the informed consent in medical treatment today, or what? What you can say about this?
Well, in general, for other medical procedures, informed consent in the United States is much better. So there's been more testing of drugs For surgery, you have to sign lots of papers. They tell you the real risks because the hospitals or the pharmaceutical company can be sued. And so they have an incentive to tell you everything that could go wrong. What makes vaccines so different is that you cannot sue the vaccine manufacturers or the doctors. So people aren't getting adequate information. So the legal system does not protect informed consent when it comes to vaccines. In general, it does when it comes to drugs and surgery because people can react. They can do something if they were deprived of informed consent.
Yeah. What are the legal precedents you think should be challenged or overturned regarding medical autonomy?
Yeah. So there are several things that need to change. One is a Supreme Court precedent from 1905, before women could vote, before there were antibiotics, before there was refrigeration, before there were airplanes or cars. It's a very outdated decision. It's a short decision, but it basically says that a legislature can mandate vaccines. Mm-hmm. That has got to change. The law has evolved a lot since then, giving people personal autonomy rights and federalizing the rights of free exercise of religion, free expression, and so on. The other things that need to change are two laws from Congress, 1986 National Childhood Vaccine Injury Act, and the 2005 Public Readiness and Emergency Preparedness Act. Both of these laws give this kind of blanket liability protection to the vaccine manufacturers, to the healthcare providers, and to the government planners. All of that liability protection and all of that coercion really must be challenged. There are other things, but those are the key things.
Mm-hmm. I have a question regarding like a school treatment about vaccine and requirement. Now, during Trump campaign, what is your advice to give parents the power to navigate this terrain? I mean, there is lots of concern regarding this mandate. I mean, the vaccine requirements in school. How can we deal with it?
So in 46 states, Maria, there is the right of a religious exemption. You can, in 46 states, say, these vaccines violate my religious beliefs for my children, and they will not be vaccinated. And in 46 states today, you may have to send that in every year, but you can avoid vaccination for your children. In 50 states, in theory, there is a medical exemption. If you could become injured or die from a vaccine, you should have a right to opt out of it. Mm-hmm. Now, let me give you the real story. The medical exemptions are absolutely frowned on by the medical profession and the government, the states. So it's very hard to get medical exemptions. In 4 states, New York, California, Maine, and Connecticut, there are no religious exemptions today. The states have said we don't have to offer this to you as a matter of constitutional federal law, and we won't. Children's Health Defense and 40 other organizations have written to the Religious Liberty Commission that President Trump created, asking him to consider an executive order that would require states to have a religious exemption if they want to get discretionary federal funding for their schools, for their educational institutions.
Yeah.
I believe that you must have the right to decline an unwanted medical intervention. You should not need a religious exemption. But right now, what is institutionalized in the vast majority of states is the right to decline on religious grounds, which can include atheism. Your religion is whatever you say it is. We have a very broad concept of religion in the United States by law.
Yeah, you spoke earlier about the censorship and free speech. So you've spoken about it in many, I saw you in many platforms talking about this. How serious is the threat to democracy and open debate?
It's a huge threat, Maria. So during COVID, and frankly, during the Biden administration, We saw what we call the censorship industrial complex. The government was working hand in glove with legacy media, the New York Times, the LA Times, Reuters, Associated Press, together with social media, Facebook, Google, TikTok, Instagram.
Mhm.
All of them together had agreements, written, clear agreements to censor information like ours that would challenge the narrative about COVID and about the COVID vaccines in particular. The Trump administration has ended funding to this industrial complex. So they've stopped funding Stanford University for Internet Observatory. They've stopped overtly working with Facebook or with some of the other platforms. But the censorship is continuing. We are still unable to get on Facebook or Instagram or TikTok. And we are downgraded on Google. And we think this is really a problem. And to your point about democracy, no, democracy can only exist when there is freedom of the press and free speech. Now, what has happened since COVID is the burgeoning of this alternative press, if you will, Substack, lots of things on the internet, the creation of new social media platforms. I see all of that in a very positive light, but the issue around
social, we can use it through social.
Absolutely. Truth Social is a great platform. X has become much freer than it was, but it's not over, Maria. We were just talking about this last night with our community. The censorship issues are not over, and frankly, they're never over. When freedom of expression is being limited or free religious exercise is being limited, that is the beginning of a very bad scenario. We know that from history.
Yeah, I want to ask like a question about Anthony Fauci. Now he's facing impeachment. What is about his case? Like, is there any formal investigation related to his role during COVID-19? Do you have any information or background about
well, he received a federal pardon from President Biden, but that does not interfere with state investigations or state prosecutions. So there certainly are states that are investigating what he did. And I was at a lecture last week, Maria, with Senator Rand Paul, who said that every time he returns home, his wife asks him, why is Tony Fauci not in jail? And I think that's a reasonable question to ask and a really important one, because he did assume the authority to tell everybody what to do. And his advice, frankly, was terrible. Right? The advice to isolate, the advice to mask, the advice to take the PCR test, the advice to take remdesivir, the advice to take the COVID shots, all of those things really had no adequate scientific basis whatsoever. And they were very harmful. The 6 feet distancing, all of it.
Yeah. Can we know from you what is the immediate impact that RFK Jr. did for the health since he was appointed becoming HHS secretary? Can you tell us? Yeah.
A lot, Maria. In a very short period of time, he is really going about pretty much revolutionizing what HHS does and how it's perceived. So among the early things he did is he actually reduced the staff by about a quarter, which was a very aggressive thing to do. He created a Make America Healthy Again commission and issued a major report with President Trump after 100 days. He created something called Operation Stork Speed to make baby formula safer. Remarkably, there are heavy metals in baby formula that's on the market. Wow. He's done many things with a variety of states to push forward laws that make people healthier, including getting rid of fluoridation of water, banning petroleum-based food dyes, and restricting SNAP benefits, social welfare benefits for things that aren't food, like sugar sodas that really can make people sick. He's overhauled the Food and Drug Administration's GRAS program, generally recognized as safe. Basically, industry was pushing through things with no testing by the regulator. He's modified the regulations to the recommendations for children and pregnant women to get COVID shots. It's now a choice between you and your doctor. He cleared out the past members of the Advisory Committee on Immunization Practices. He dismissed 17 members. Installed 8. They're meeting today. And one of the things that they talked about today was getting rid of the mercury-containing preservative thimerosal in all flu vaccines. Also, it was announced today by the chairman, Martin Kulldorff, that they will be looking at the cumulative impact of the whole federally recommended childhood schedule, which has never been adequately done, which is very exciting. He's also committed to finding the real causes of the autism epidemic, which now affects 1 in 31 children. So he's been very active, Maria. We don't agree with everything he's done, of course, but we tremendously support these things that we believe will end the chronic epidemic of childhood disease in the United States.
How does he respond to being the center of many heated debates? Like, how does RF Kennedy respond to being labeled as a conspiracy theorist or anti-science?
As he says, he's developed a very thick skin over the last 20 years. He came out in 2007 with his article against the mercury-containing preservative thimerosal. He is a lawyer by training. He is used to people in the adversarial system. So he doesn't take it personally, Maria, and he moves forward. He's not going to be derailed because people call him some really ill-founded names. As he says, he vaccinated all of his children. He's pro-science, and he said he's never going to take people's vaccines away from them if they want them. He's just going to advocate for truth and for real science and for transparency.
Mary Holland, last word. Can we know about your personal or spiritual philosophy that guides your advocate work that you can tell to our audience from all over the world?
We are all trying to create goodness in the world and health, and especially for children who come in and who are completely innocent. As Bobby Kennedy says, they're not political. They're not Democrats or Republicans or pro this or pro that. They're just children, and they deserve health, and they deserve to be in a healthy environment. And that's what we're trying to do.
Mary Holland, thank you for your time. I'm so glad to have you. Thanks.
Thank you. A pleasure to be here.